Hi, my name's Adam Winstock. I'm a consultant psychiatrist and founder of the Global Drug Survey. In this video, I want to talk to you about the link between alcohol and mental health. Lots of people who drink too much will tell you that they drink too much because of underlying mental health disorders, whether that's depression, anxiety, obsessive compulsive disorder, or PTSD. And it's absolutely true. Some people develop alcohol dependence after a severe life event that leaves them traumatized or depressed, and they find solace, at least in the short term, by drinking. But there are also many people who have been drinking for many years before they become aware of the fact that they're low in mood, they're anxious, or they're no longer coping with life. And it's sometimes difficult to know what came first. I think the order of diagnoses are actually really important, because if you're someone who thinks you're depressed because you're drinking, then actually if you stop drinking and you get better, you've got your answer. You've got your cure for your depression. But equally, if you're someone who is depressed while drinking, but you're being treated with antidepressants and you're not getting better, you don't know whether or not it's because of your alcohol, because you genuinely have a depressive disorder. I see lots of patients who present with alcohol dependence who are taking antidepressants, and they're simply not working. And in that instance, the advice I would give is to find a way of cutting down and stopping your drinking safely and staying on your antidepressant and see what happens. If in fact a month after not drinking, while staying on your antidepressant, you feel much happier and robust, then that's great. And my advice is to stay on the antidepressant, because we know that untreated depression or anxiety or PTSD is a risk factor for returning to alcohol. In other cases where you're someone who is drinking too much, you're also low in mood, and you seek treatment from a doctor, if that doctor then says, right, I think you need an antidepressant, what I would do is encourage you to have the following conversation. You could say to the doctor, I drink really quite a bit, and I know that drinking a lot can actually lead to depression. I'm kind of slightly worried here that if I maybe, start the antidepressant and I then stop drinking and I feel better, I'm actually never going to know whether or not I feel better because I'm taking this antidepressant, or whether actually I stop drinking. And I think you understanding why things get better is really important if you're going to maintain your recovery. I guess the other things I just want to highlight is that people who drink at dependent levels and also have depression are at huge risk of suicide. 2/3 of the people who complete suicide have an alcohol use disorder. You have to take threats of suicide by people who drink really seriously. They can't be ignored, because even if they don't mean it, because the fact they're intoxicated means they can end up doing terribly reckless things. What we know is that suicidal ideation and people's mood gets better when they stop. What we also know is that effective treatments for depression are much more effective when people stop drinking. That also goes for psychological therapies. You're much more likely to benefit from CBT once you've actually stopped drinking. The bottom line is, if you're someone who's not as happy with your quality of mental health, how you feel in the world, how you relate to other people, and you drink too much, my challenge to you is to safely get advice about how to stop drinking, and then review how you feel about the world. The vast majority of people feel brighter, better, and stronger. It's then about accessing all the support systems you have in your particular community to help stay sober. And that also involves mutual aid groups. So the last thing I want to talk about is the role of AA. AA is an amazing organisation. It's free, it's available around the world, and it doesn't just give you an army of people who have embraced a sober life and have shown that they can be happy and move on with their world, but it also gives you a network of people who can be some of the most supportive, available people in the world. AA is generally available in every city, in every country, every single hour of the day. And that little book can help you find people who can make a difference to your life. Now, AA works for some people just like some of the medications I've spoken to works about it. But what I would say to you is, even if you're not religious, the whole idea of giving yourself up to a higher power, it's not a religious idea. It's about accepting powerlessness and allowing you to embrace other powers within yourself. So if you've never been to AA and you've got an alcohol problem and you've stopped drinking, I encourage you to go to an AA meeting and see what it's like. The other thing is that AA, because it's such a huge, broad, nuanced organisation, has lots of different meetings for lots of different groups. There's AA meetings for family members, for teens, for women, for doctors, for nurses, for lawyers, for construction workers. find an AA meeting that might work for you.